Hey everybody! Let's talk about iron deficiency anemia. So in previous videos we have talked about anemia. What's anemia? Also microcytic anemia, iron studies. So if you need anything from previous subjects, please go ahead and watch previous videos first. So this one can make sense. Let's talk about iron deficiency anemia. Tired and pale? Pale and tired. Some quick facts are about iron deficiency anemia. It's the most common cause of anemia worldwide. In the developing world, it's usually nutritional, like nutritional deficiency. In the developed world, it's usually acute blood loss from GI bleeding or especially peptic ulcer disease. It's the most common cause of nutritional deficiency worldwide. The risk population includes females. Why? Menstruation. Children. Why? Decrease intake. High demand because they are growing. What are the causes? Imagine that you are a businessman. So, when you have a problem, it's either decreased supply, or increased demand, or loss. Decreased supply, such as nutritional deficiency or malabsorption. I'm not getting enough iron, or I'm getting enough iron but I cannot absorb it. What's the difference? It's basically the same. Increased demand, such as increased utilization. I need more iron now. I need more and more. Or loss, such as blood loss, or hemolysis. The RBCs are being destroyed. So the causes of iron deficiency anemia are decreased supply, increased demand, or loss. Decreased supply, we said nutritional deficiency or malabsorption. Nutritional deficiency, such as prematurity. Premature babies are more risk of getting iron deficiency anemia. Poverty and nutritional deficiency, they are not getting enough food or enough minerals. Also, old age, the same problem as the kids. Diet, some people who are strict vegans, they are not getting enough heme iron. Because as we have said before, there are two types of iron. The heme that we get from meat products and the non-heme from the vegetables. The heme iron is better absorbed than the non-heme. So people who are strict vegans, they eat only vegetables, they're increased risk of getting iron deficiency anemia. Malabsorption, such as celiac disease or post-gastric surgery. How about increased demand? Increased utilization, such as pregnancy. So the lady is not only feeding her body, she's feeding two bodies. She needs more iron. Also lactation, same concept. Growth, I'm needing more iron because I'm building new cells. Loss, such as blood loss or intravascular hemolysis. Blood loss, such as peptic ulcer disease, Meckel's diverticulum. Peptic ulcers usually in adults, Meckel's in kids, because Meckel's has some gastric tissue in them sometimes. So they can bleed. Hookworm infection. Hookworms such as Ancylostoma or Necator americans. Ancylostoma duodenale or Necator americans. Colon polyps can bleed. Colon cancer, of course, can bleed. These will lead to blood loss, which will lead to iron deficiency anemia. Intravascular hemolysis has to be intravascular, so the blood will get broken down, then eventually they will go through the kidney and they will lose a lot of iron there. So we have microangiopathic hemolytic anemia and a condition called paroxysmal nocturnal hemoglobinuria. These are the causes of iron deficiency anemia: decreased supply, increased demand, or blood loss. Let's review. So hemoglobin consists of heme and globin. Heme consists of iron and protoporphyrin. So when I have iron deficiency anemia, iron will be decreased. Decreased. Hemoglobin decreased. That's why it's anemia. Anemia, low hemoglobin and hematocrit. By definition, globin will be normal. Okay, since protoporphyrin will not have enough iron to bind with to form heme, protoporphyrin will start to pile up. Okay, hematopoiesis. We have proerythroblast all the way down to the mature erythrocyte. Cells start up big, then they get smaller and smaller and smaller. So here's the mature red blood cell. The cells are waiting for cell division and they're waiting for iron. So if iron is not coming, they will keep decreasing in size like this. We end up with small cells. That's why it's called microcytic anemia. They are still waiting for iron. By the same token, them being so small will get the hemoglobin inside them to look relatively bigger. So they are trying to mitigate the problem. Clinically, iron deficiency anemia, such as any other anemia, tired and pale, pale and tired. Sometimes I have angina, sometimes I have murmur. Weak, irritable, exercise intolerance. We have sometimes other associations, such as Plummer-Vinson syndrome with esophageal whips, glossitis, cheilitis, inflammation of the tongue and the lips, restless leg syndrome for an unknown reason. Restless leg syndrome is associated with iron deficiency anemia. This is high yield. Achlorhydra, when we have talked about iron absorption, we have mentioned that HCl is necessary to convert the ferric iron into the ferrous, which is more readily absorbed. Also, there is an association with celiac disease, as we have mentioned. It's a malabsorption problem. We have spoon-shaped nails called koilonychia. Coiled nail. Beeturia. 10% of the general population, when they eat beets, they get red urine. In iron deficiency anemia, almost all of them will get the beeturia. Pica is craving for ice. Not just ice, but any ice-containing drink, such as iced coffee. They just want the ice. Why? I don't know. So remember these associations. Also, the pica is also known as pagophagia. Hematology is all about lab results. The story of iron, that we have iron in the serum, gets on transferrin, the bounding protein, then gets stored in the tissue as ferritin. So, as an anemia, what will happen to hemoglobin and hematocrit? They'll both be decreased. That's a given. MCV, since it's a microcytic, MCV is low. MCH and MCHC, they'll be low. It's an iron deficiency anemia. It's anemia. Reticulocytes will be low. Why is that? I don't have enough iron to make mature RBCs, or even immature RBCs. I don't have enough iron, period. White blood cells are usually normal, except there is one exception. I'll mention it later. Platelets may get slight increase. Why is that? Because sometimes the erythropoietin is very similar to thrombopoietin. Okay, that's the theory. Other theory is that now anemia, the blood is very thin. Let's try to make it thicker and more dense by producing more cells. I cannot produce RBCs, at least I can produce more platelets. What about the iron studies? That's crucial. Serum iron definitely decreased. Okay, it's iron deficiency. How about ferritin, the stored iron? The store comes from where? From the serum, so they're decreased. How about TIBC? The liver recognizes the problem, says, hey, we're not having iron. Let's get more carriers to try to catch the last iron molecule left. Let's try our best. So TIBC is increased. And as we have said before, ferritin and TIBC are always inversely related to each other. Percent saturation, of course, is decreased because percent saturation is the iron on the transferrin. And since iron is decreased and the TIBC is increased, the ratio, of course, will be decreased. How about this one, the soluble transferrin receptor assay? This one will be increased in iron deficiency anemia, but normal in anemia of chronic disease, as we've said before. RDW is the variation in the sizes of red blood cells. And if you go back to our video when we have talked about RDW, Rome did not fall in a day, and neither did the bone marrow. So it happens gradually. There is a wide variation, so the RDW is high. But wait, there's an important piece of information here. Ferritin is an acute phase reactant due to influence by interleukin 6. So, if I have a patient with iron deficiency anemia, I expect to have ferritin to be low. However, if he has concurrent inflammation, maybe ferritin will be high. Oh, how can I know? It will not be accurate. It will not be helpful. That's why the soluble transferrin receptor assay is accurate. It's not influenced by interleukin 6, so you'll have this one will be high. Okay, so that's how you know the difference. So, long story short, do not rely on ferritin if you have ongoing inflammation. Rome did not fall in a day, neither did the bone marrow. Start as normocytic, then become microcytic. Microcytic cells have increased central pallor. And since protoporphyrin is left alone, start to pile up, so we have increased free erythrocyte protoporphyrin. There is no iron to join it. Poor protoporphyrin, you'll be left alone. What's the most accurate test to diagnose iron deficiency anemia? It's bone marrow biopsy. And by the way, it's very painful. The periosteum is very sensitive to pain. So, do we usually do bone marrow biopsy just to diagnose iron deficiency anemia? No. There is an easier way to diagnose it. What? Give the patient iron. If they improve, it's iron deficiency anemia. Bingo! Okay, what will happen if we did a bone marrow biopsy in a patient with iron deficiency? We will have depleted iron stores evident on the biopsy. Okay, we've mentioned that iron deficiency anemia usually have normal white blood count. But there is one exception. You know what's that? Yes, when there is a hookworm infection. Hookworms such as Ancylostoma duodenale and Necator americans. What's the treatment of iron deficiency anemia? We start with oral ferrous sulfate. It has side effects? Yes. Sometimes diarrhea or constipation. Black stool, since iron will come in the stool. However, this is guaiac negative stool. Why? Because it's just iron. There is no blood. Remember, guaiac stool test detects RBCs, hemoglobin, myoglobin. Since we have only iron in stool, it'll be guaiac negative. Failure of treatment, sometimes because patients are not compliant with the treatment, okay? Also, blood loss, if it's going on, it will not fix it just to give him iron. Absorption problem, this is very important. Resistant cases to treatment usually have celiac diseases. Okay, what if first one failed? Let's start. Intramuscular intravenous iron. What's the biggest side effect? Anaphylaxis, especially if it contains dextran. That's it. That's iron deficiency. Please subscribe. There are new videos coming every week. Thank you for your support. I'll see you in the next video to continue talking about microcytic anemia. Peace.